Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we'd also like to welcome Laura Hollingsworth, Senior Vice President and Chief Marketing Officer at Opry Entertainment Group, Ryman Hospitality Properties, and Monique Odom, Director of the Metro Board of Parks and Recreation. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, I want to begin with a word about our ongoing recovery and rebuilding efforts from the March 3rd tornado. We're grateful for the local work of the American Red Cross, as the Red Cross is a short-term relief organization for the storm. Our friends at the Tennessee Conference of the United Methodist Church will now manage long-term disaster case management. Storm survivors will receive a phone call from our long-term tornado relief partners to ensure that you remain connected to all the community resources you need. If you or a loved one are currently experiencing an unmet need as a result of the tornado, please call Tornado Recovery Connection at 615-270-9255. That number again is 615-270-9255. This hotline is open 24/7. The Community Foundation of Middle Tennessee's Emergency Response Fund is also continuing their tornado relief work with grantee organizations to provide direct relief to residents affected by the March 3rd tornado. To date, the foundation has received nearly $10.2 million in contributions with $1.38 million in outstanding pledges, for a total of $11.58 million from more than 21,500 individual, corporate, and foundation donors. 93 grants totaling just over $3 million have been made to 83 different nonprofit and religious organizations in Davidson, Putnam, and Wilson counties. A new group of grants will be announced later today by the Community Foundation. Now, nonprofit organizations who wish to apply for Community Foundation grants and individuals looking for a list of grantees providing direct individual assistance can visit tornadoresponse.com, which is very easy to remember. That's tornadoresponse.com. Now, we also want to continue reminding all residents affected by the tornado that the FEMA and SBA application deadlines are quickly approaching on Monday, May 4th. To date, FEMA has approved approximately $2 million in disaster grants for 645 homeowners and renters who sustained uninsured or underinsured losses from the storms. And the SBA has approved just over $9 million in disaster loans to businesses and households. If you suffered property or economic damage from the March 3rd tornado, do not leave federal financial assistance on the table. Apply today to ensure your application is received before the deadline at disasterassistance.gov. Again, the website for FEMA and SBA applications is disasterassistance.gov, and the deadline is Monday, May 4th. Now, the hard work of rebuilding our storm-damaged neighborhoods continues, even as now we must remain at home and practice safe social distancing to prevent the spread of COVID-19. This morning, I want to welcome back Laura Hollingsworth, Senior Vice President and Chief Marketing Officer at Opry Entertainment Group, who has joined us as a valued member of the Major Metro's Economic Restart Task Force, and to provide a business and hospitality perspective on the roadmap for reopening Nashville. As we announced yesterday morning, the roadmap for reopening Nashville has been released, and we are carefully monitoring public health benchmarks required to begin phase 1 of the plan as soon as possible. Now, these benchmarks include an acceptably stable or sustained decline in new COVID-19 cases over a 14-day period, adequate testing and PPE capacity for our region, a low transmission rate, and a robust public health infrastructure to conduct contact tracing investigations throughout our community. I want to remind everyone that regardless of our progress on our roadmap for reopening Nashville, a complete return to business as normal will take time. We will continue to engage in dialogue as a community to inform and update our economic reopening framework to best suit our residents' needs. Remember, your efforts will largely determine the end of the Safer at Home order in Davidson County. Continue to flatten the curve, and that is the fastest way to get Nashville safely back to work and get our economy back up and running. Please continue remaining safely at home, except to run essential errands and wear face coverings when you are unable to maintain proper social distancing protocols. Now, a wonderful way to change your daily routine while maintaining proper social distance is to take advantage of our many parks and green spaces. Currently, Metro Parks oversees over 16,000 acres of open space, including 178 parks and nearly 100 miles of beautiful greenway and trails. I want to welcome today Monique Odom, Director of the Metro Board of Parks and Recreation, who is here to discuss Metro Parks' role in our COVID-19 response and how you can stay safe while enjoying the outdoors in Davidson County. These are extraordinary times, and I'm proud of the way Nashvillians have come together while practicing good social distancing measures. Let's keep up the good work, keep our rate of COVID-19 cases down, and get Nashville back to business as usual. And as always, visit Metro's COVID-19 website and consider donating, as you are able, to the COVID-19 Response Fund by visiting covid19.nashville.gov. You can also visit the website to learn how to obtain direct financial, food, mental health, and social service assistance. I'll now turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on the coronavirus in Davidson County. We now have 2,176 confirmed cases with a total of 22 fatalities. That is an increase of 32 over the past 24 hours. There are an additional 1,880 cases in the surrounding counties, bringing our total for the region to 4,056. Of the Davidson County cases, 1,043 are currently active, and 1,111 residents have recovered from the virus and have been cleared. Now, we released the roadmap to reopening Nashville yesterday, and we talked about metrics we will use to determine the timing. This morning, I want to show you where we are. We start with transmission rate. We are looking for the transmission rate to be equal to or less than 1. That means, on average, a person will transmit the virus to just one or less other individuals. We currently are under this mark for now. This transmission rate is part of the Vanderbilt model we have been talking to you about over the past couple of weeks. It will be updated this afternoon, and we will be looking to see if there's any change in the transmission rate in our region. Next, we look at the 14-day rolling trend line of new cases. This is based on the rolling average over 14 days. This trend line needs to be flat or decreasing. Currently, we are at a steady state. We are monitoring this closely because yesterday we saw our biggest number of new cases, and today's number is much lower. That's why looking at the 14-day average over 14 days is important. It gives us a better picture than the daily fluctuations. As I mentioned yesterday, we will not let a single good or a single bad day in the numbers take us off course. We also are monitoring the contact tracing resources and our testing capacity. Contact tracing is vital as we reopen. Isolated clusters of the virus may develop in our community. We need to be able to quickly identify and investigate these clusters as we can contain them and prevent them from spreading. Now, we began this crisis with only 4 contact tracing investigators. Today, we have 42. While this is an adequate number for our city, we will continue to add more resources and individuals to stay ahead of this crisis. Testing capacity goes hand in hand with contact tracing. We must have the testing ability to keep an eye on the new cases and to understand where this virus is in our community. Today in Nashville, we have adequate testing capacity for our assessment centers and our healthcare partners to report that they have capacity as well. And finally, we are monitoring our hospital capacity to ensure that, if needed, our hospitals will be ready to take care of our sickest residents. As of this morning, we have over 1,100 hospital beds, or more than 35% of the supply in our region, open for new patients. Think of this as our city's COVID-19 report card. It will show us how well we are doing in fighting this virus. So today's report card shows us that our metrics are satisfactory, but we must remain vigilant and stay the course. To get a good report card, we need to stay focused on staying at home and only go out if it's absolutely necessary. Now, we've been doing this in Nashville, and it's showing in our numbers. Based on this morning's report card, we could possibly begin phase 1 of the reopening in early May. However, we are not at a point to give a specific date at this point. Now, I know that's frustrating. We all have to know when we can get back to a new normal. But we've said it all along that the data will drive our decisions to reopen and not the dates. We will give you an update frequently on the report card and let you know where we are on the reopening road. Today, our community assessment centers are opening. As I said, these centers are an important part of our reopening plan. We need to be on top of the spread of the virus and continue robust testing, and that's the only way to do that. The centers are open until 3 p.m. today. They are located at Nissan Stadium, Meharry Medical College, and at the old Kmart in Antioch. You can drive up or walk up and be screened by medical professionals and receive a test. And all of this is at no charge to you. Now, since opening on March 31st, more than 4,700 people have been assessed at the centers, and close to 4,000 of them have been tested. Just this Monday and Wednesday, 1,634 people were tested. Our assessment hotline is also open today, and every day from 7 a.m. to 7 p.m. Medical professionals are standing by to answer your questions about the virus and direct you to resources if you need them. Since opening last month, more than 6,500 people have called the hotline. If you feel that you may have COVID-19, have been in contact with someone who has tested positive, or you're just worried about the virus, please reach out to our hotline or contact your healthcare professional or go to one of our community assessment centers. We want you to be safe. We want you to have access to the resources you need, and we want to get back to the new normal as soon as possible. I appreciate all you are doing, Nashville. We are in this together, and we will get through this together. I now would like to introduce Ms. Laura Hollingsworth. Thank you.
Thanks, Dr. Jahangir, and good morning, Nashville. The release yesterday of Mayor Cooper's roadmap for reopening Nashville was a welcome moment for all of us as we start to envision how our city can safely reopen and how we can begin to safely resume life outside of our own homes. For businesses and workers impacted by COVID-19 closures, this plan was anxiously received. Our businesses want and need to be open. Our community needs our businesses to be open. Our businesses want to keep their most valuable assets, their employees, and their employees want to be working again. And what everybody wants, especially our businesses, is to be able to ensure that our customers and our employees will be safe. The roadmap's phased approach allows for the reopening of our businesses, given deliberate and timed actions that maximize safety. The task force's goal in developing the plan was to provide a very clear and strong framework driven by data and safety-first measures, but not becoming overly prescriptive or highly restrictive for our businesses that are already challenged in this crisis. It's designed to have enough flexibility to evolve. We've been purposeful in aligning wherever possible with the state's guidelines so as not to create differing sets of rules, for example. And the plan was greatly informed through discussions and outreach with business and industry leaders throughout the city, many of whom are well into planning new safety measures and reopening processes for their businesses, even far beyond the frameworks outlined already. Since yesterday's plan release, members of our task force have received positive support and feedback from our business community. We are inspired, though we're not surprised, by the level of smart planning, engagement, and collaboration that's already happening across the city as we all prepare for this phased reopening. We are aware of many subgroups and industry groups working together to share best practices, to discuss new ways to ensure customer safety. For example, there's a group coming together later today from all the large venues in the state, from UT to the Memphis Grizzlies, to Bridgestone and the Predators, and the Opry and the Ryman and TPAC and the Symphony, Live Nation, and others to discuss protocols and safety planning for our largest venues. Many hospitality groups, retail groups, restaurant groups are holding virtual brainstorming sessions involving the smallest to the biggest businesses. Our businesses can and are being proactive in this process. We know that one of Nashville's greatest competitive advantages has always been our collaborative spirit. It is through collaborative work that we'll take the right and the best steps to get back to business safely and in even smarter ways. Task force members have also begun to receive inquiries in search of more specifics or further direction about compliance with the plan, which we are happy to help seek answers to. Early questions have ranged from specific dates and timing of phases to whether lower Broadway venues are included with restaurants in Phase 1 opening, and they are, to how to perform daily employee health screenings, for example. To that end, we want to remind business leaders that the Metro Public Health Department is available for individual consultations and to work with businesses directly as it pertains to health safety and compliance. And in fact, we urge you to make that contact. These individual meetings can help confirm that your business is ensuring all of the right safety steps and clarify any questions. The Nashville Chamber of Commerce is also a resource. The Chamber currently has a COVID-19 response page on its website at nashvillechamber.com/coronavirus, and it is regularly updating. As Metro Nashville posts where the city is in its phases in its reopening, the Chamber will also be actively alerting our businesses. Of course, the Convention and Visitors Corporation is also a great resource to hospitality businesses, and as is the Tennessee Hospitality Association. In addition, specific questions on or suggestions about the roadmap can always be submitted by going to hub.nashville.gov. We are expecting that there are going to be questions that we don't have answers to yet, quite frankly, because there are things we just don't know yet. What we do know is that we can begin by taking the steps that are within our control now and are reflected in the roadmap, and do them in a way that will engender the trust not only of our local customers, but also the customers who come from all corners of the world to visit us in this great city and are critical to our Nashville economy. Our objective right now must be to earn consumer confidence and trust through the right and safe actions. We will let the country and the world know that Nashville is a safe place to visit again soon. Thank you, and I'll now turn it over to Monique Odom, Director of Metro Parks and Recreation.
Thank you, Laura, and thank you, Nashville, for your support and observing closures of certain parks and recreation features and facilities, and for practicing social distancing when you're in public. As you know, besides washing your hands and staying at home away from others when you're sick, social distancing, that is, remaining socially connected and physically distant, is one of the best strategies you can use to reduce the spread of coronavirus. Parks Police continue patrols to remind parks users of social distancing protocols. Now, we recognize that physical distancing may take a toll on our mental health, especially during high-stress and anxiety-producing global public emergencies. We know that parks provide a connection to the outdoors and green space, as well as opportunities for physical activity, which studies demonstrate reduces stress and improves mental health. And we also recognize, now more than ever, the power of parks and open spaces as essential resources for health and wellness. We are blessed to have an expansive park system in Nashville that spans the entire county, and as Mayor Cooper mentioned, includes over 16,000 acres of parkland, 178 parks, and nearly 100 miles of greenways and trails. so distancing should not be a challenge. We believe that many parks, trails, and open spaces can continue to be used in a safe manner that allows people to enjoy the mental and physical health benefits of these spaces. We want you to get out there and enjoy these green spaces, but you must do so safely, remembering that your choices impact us all. We will continue to turn to National Recreation and Park Association best practices for guidance and work closely with the COVID-19 task force to determine when park features will open using a phased approach. Our local parks, trails, and greenways have always served as places where people can find respite and seek peace and restoration. During this time of uncertainty, these places are needed more than ever. Let us all do our part to use them in a way that respects each other and public health guidance. Thank you for your support and cooperation.
Thank you, Ms. Odom. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Julia Palazzo.
Good morning, everyone. Thank you. I have 3 questions. 2 are for Mayor Cooper, if you don't mind me asking them all at once. Mayor Cooper, do you know, these are from viewers actually, the status of when city and county offices will reopen to the public? And my second question for you is, this is from a restaurant owner. How can restaurants order product and plan for reopening without a specific date? And I can ask my third question for Dr. Jahanger after if you'd like me to.
If you would, Julia, if you'd go ahead and ask your question for Dr. Jahangir, please.
Sure, thank you. Since Nashville is following their own plan and surrounding counties are following another, doesn't it negate the effectiveness of the phased reopening when most people in Nashville can drive less than 10 minutes for non-essential businesses? Thank you so much.
Thank you, Julia. Mayor Cooper.
Thank you, Julia. City and county offices will reopen on the phases of the roadmap being implemented. So essential things, of course, are continuing on right now. Police, court system in terms of being able to operate. And as the county is able to reopen, then all the services of Metro and offices will reopen. The question from the restaurant owner, I think, is give us enough time. And that's what we're trying to do this week, today, this meeting. We're alerting people that the start, hopefully, is around the corner. But we will let people know with adequate notice to start. Now, people need to be aware that some businesses are going to need to start slowly. In the case of restaurants, 50%, retail, 50%. So we can all bring up our capacity together. Thank you.
Thank you about the question regarding surrounding counties. So Nashville is a regional city, and during full times, about almost 1 million people drive into Nashville when we're at full business every weekday. Part of the reason I share with you almost every morning, and I did this morning, nearly 2,000 or a little over 2,000 people in Nashville have the virus, and nearly 2,000 in our community have the virus in surrounding counties, is because, yes, it's all interactive. But here's the thing. We are following the science and the data to, be the first in the state to do the safer stay-at-home order. We are going to reopen in such a fashion. We are grateful for our regional mayors and partners who saw that we are all in this together and had a safer-at-home order placed in our regional counties. And I hope that as we do a data-driven reopening, that our regional mayors will also do the same. But Mayor Cooper's commitment and my commitment and everyone else's commitment is to the people of Nashville, and we will do the best for the people of Nashville. Thank you.
Kara Hartnett at the Nashville Post.
Hi. Thanks for the question. I have two today. So my first one is local businesses are starting to put out promotions saying the
Kara,
open on May 1st. Are you guys hearing?
you're,
Hello, can you hear me?
Yeah, you're breaking up a little bit. Could you repeat your first question, please?
Yeah, if businesses are starting to put out promotions saying they'll be open on May 1st, are you communicating with businesses and what will happen if they open then? And my second question is about the assessment centers. It looks like they've seen increases in testing. Can you talk about what you're seeing with demand and whether that influx was from identified clusters or people generally just seeking tests?
Thank you, Kara. Dr. Jahangir?
Garrett, thank you. Our safer and home order right now is until May 1st. And if we need to extend that, we will. And we asked our friends in community of Nashville to continue following the order as they have been for the most part. But we do have our enforcement arm if need be. So that's the thing regarding safer home. As of right now, it's May 1, and if it needs to be extended, we'll extend it and continue the enforcement as needed. Regarding the assessment centers, you're right. We had almost 1,600 people Monday and Wednesday, maybe even more than 1,600. To put that in terms, I mean, the first few weeks in operations, we had a total of 1,600. Part of that increase part of that increase, I think, is there's just more demand. People are recognizing the need to get it. This is not a single cluster that we're pushing towards one facility or another. I mean, these are just people wanting more demand, and we're fortunate to be able to provide the people of Nashville what is needed. And we're able to keep up with the supply. And as you and I have discussed before, we've also have made the criteria for testing more and more open as the standard of care changed in our community. And so right now, we're able to meet it. The lines are still really low. And so I'm happy for that. I mean, we need to, one of the metrics of reopening is we need to have a certain amount of testing capacity, which I'm glad we have right now, and we'll continue to provide that service. So thank you.
Nancy Amons at News 4. Go ahead, Nancy.
Thank you. I have a question for Laura Hollingsworth, please. You were talking about the plan being anxiously received and that you are talking about the flexibility. And I'd like to just hear more thoughts on her conversations with the business community and how they're reacting and the need for flexibility as we go forward.
Ms. Hollingsworth.
Yes, thank you for that question. The first thing that we started to do as a task force was to start to reach out to leaders in these businesses and the industries who know them best. And quite frankly, what we found was, and not surprising, these leaders and businesses know what they're doing, and they were ahead of it, and really weren't waiting to be told exactly what it needed to be done. So everybody was sort of busy getting at it. But we were able to have a lot of conversations and understand some of the dynamics of different businesses and be fed some of that. We had the partnership of many in thinking about how we go about this most safely. So we were really blessed to have that, and I think thus came out with a framework that could be flexible and could continue to evolve and serve our business community. I think for the most part, we found that the framework was very well received, and I do know this, our businesses are as focused on keeping people safe as anyone. So when you work in partnership like that, it's just been a very good experience, and we'll continue to work with our businesses to keep informing what we're doing.
Yin Jung at the Tennessean. Yin, are you there? Go to Samantha Max at WPLN. Samantha?
Very good experience.
Samantha, can you hear us? If not, we've addressed all the media questions in the WebEx queue this morning. I'd like to thank Ms. Laura Hollingsworth and Ms. Monique Odom for joining us today. Live press briefings will resume on Monday, April 27th at 9:30 a.m. As a reminder, You can always visit covid19.nashville.gov for up-to-date information on Nashville's coronavirus response. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.